discuss today the impact of the COVID in our lives, and going forward, what is it that we should expect and what is it that we can do. Now, we all know that there is nothing in our living times that has been more unprecedented, more colossal, and caused more damage, not only to the health of individuals, families, or nations, but also made sure that business, travel, transportation, everything had been brought to a halt for almost 2 years. So let's begin by looking at what COVID was all about. It was something, a new disease in a way, an infective disease. We knew nothing about it when it started. We thought we knew a lot about it during the period that the first 6 months was. And with each passing day, week, and month, we have continued to learn that we don't know enough about it. So it is a magnitude, along with the lack of knowledge about the disease and its progress itself, which has been a major, major concern. The second issue is, unlike some diseases where you treat the person who has a disease or treat the group of people who have the disease, you have solved the problem. Here, there was a major question of transmission. Transmission from person to person, through the air, through public and private spaces. So it was not only to make sure you looked after those who became ill, you needed to make sure that people did not contract the disease from people who were known to have the disease or who probably did not know that they had the disease. To begin with, everybody assumed that it was something to do with the lungs and the respiratory passages, which was causing the problem. But as we moved along, we realized we were completely wrong. It impacted every body system, either immediately or later, or a combination thereof. So when we look at what it has done to the healthcare, it has also highlighted the major deficiencies of healthcare in itself. Healthcare as an overall understanding of what healthcare includes. Number two, how is it delivered? And how does the person receiving care perceive the value of the healthcare? One of the most important things we realized was people who had underlying diseases like diabetes or blood pressure, kidney failure, cancers, lung diseases, they suffered much more than those who did not have these conditions. We also realized that people whose innate primary immunity or resistance was better were able to deal with the situation better and emerged much better despite more aggressive disease in some situations. So clearly indicating that the direction in which the healthcare has to go has to focus on prevention of many of these conditions. Preventive health and a state of wellness is one way to prepare the entire population that in case they do contract the disease, they do not suffer significantly. Second was the public issues. This was not a condition which was managed by the medical people or the hospitals alone. It was managed by the governments. It was managed by the security personnel. It was managed by the sanitation workers. It was managed by every member of every family. So it is the public participation, the public perception of the value of hygiene, the value of hand sanitization, the value of social distancing, the value of masking. So it was a great lesson how information needed to percolate at every level for us to be able to achieve what we had to do. Secondly, you realized that the government on its own could not have managed such a mammoth increase in such a short period of healthcare challenges. They had to be partnerships between the government and the private healthcare industry in a large manner. Similarly, if you see, the social organizations came together to provide support to hospitals, to smaller healthcare unit, to the not-for-profit organization, be it in terms of food supplies, be it in terms of providing PPE kits, be it in terms of providing oxygen, be it in terms of providing oxygen concentrators. The public at large came together very well. One individual that we really would like to talk about is Amit Chandra. Amit Chandra, going along the lines of Chuck Feeney, decided that contribution from individuals matters, and it matters most in times of urgency. Many of you would know that he, in a matter of less than 2 months, managed to mobilize funds of well over 11.5 crores, including 5 crores from himself, to provide meals, food and food items to over 77 lakh individuals. So I think the ability of individuals and the community to come together was perhaps, to me, the biggest learning. Thirdly, we all know that when you look at private healthcare industry, which actually bore the brunt of the severe hospitalized tertiary care, actually ran into substantial financial losses. The other factor we must realize is our dependence. Despite being among the largest pharmaceutical industries in this country, despite a very large scientific community of researchers and industrialists with greater emerging Atmanirbharata, we realize that on a lot of raw material, we are still dependent on imports, which is not great for the future. So having looked at the global tendency on that, let us look at what is it that we need to look at it from the health point of view. What is it that you and I need to understand to remain healthy, make sure that people who work with us and for us remain healthy, and how we make sure that industries continue to regain and retain productivity without compromising healthcare. When you look at how you address COVID, we all know that people who became mildly ill just needed observation at home, looked after their nutrition, their hydration, and made sure they were moving about adequately to keep their muscle mass intact, and made sure that they remained focused on their health and tried not to feel lonely. The second is those who became sick and were hospitalized at various levels of hospitalization, including several who spent weeks or months on the ventilator in hospitals. And when they did recover, it was after a lot of anxiety, a lot of significant impact on various systems in their body, and it will take them several months to regain what could be considered a normal pattern of life. So the treatment of these in the hospital is not what I'm going to be talking about. I'll be discussing with you mainly what you and I would need to do in terms of recovery after the acute illness, because the acute illness had obviously been managed in the hospital and people have recovered. But how do they go back to their completely normal lives and retain that quality of health? We know that this depended on the degree of damage they underwent to their lungs, to their respiratory passages, the other secondary infections that resulted from these, the changes in their body to their blood sugars, their blood pressures, and also to the changes in their heart because of the potential to form blood clots in the body. Similarly, there were a lot of changes in the heart rhythm or arrhythmias, which caused a lot of problems. We also know that while the healing process was going on, a lot of people developed what we call fibrosis in their lungs, or the ability of the lungs to expand adequately. We also know that there were many neurological conditions similar to stroke, similar to non-stroke medical conditions, which resulted from the sequelae of the disease or the treatment, or perhaps a combination. We all know that people had their blood sugars going everywhere due to the use of steroids. But the two major things I want to talk about, which are not directly linked here, and which was all pervasive, one was the problems associated with nutrition in people, and second, significant psychological impact. The people felt so low, so lonely, so helpless, that to even make them understand that there was hope and that there was a potential to survive was a big challenge. There were major problems with health which were looked in the face of it unconnected. Like I said about the heart rhythms going badly, the ability of the heart to pump adequately, etc. And going forward, we know that some of these people with the best of treatment may require long hospitalizations and may never go back to normal life. But the idea here would be, how are we going to make sure that the majority of the people are able to regain the normal state of health? So we need to look at what was involved in a given patient. Was it the chest and the respiratory thing that was involved? Was it their cardiac conditions which are a problem? Was it their cognitive and neurological conditions that were a problem? Was it more to do with their stomach, the gastrointestinal functions? Was it deficiencies? And was it their psychological things? Needless to say, it had to be a multidisciplinary system involving family physicians, psychologists, chest specialists, cardiologists, and several other people, including neurologists. So when we looked at trying to divide how we were going to look after these people, we divided them into 5 different phases, including the management in the ICU, the management once they return to the ward. This again is beyond the scope of our talk here. But what happens is the next level is important, what we call the phase 3 of the management, which is when they have left the hospital and they are getting back home and trying to integrate with the rest of the society. Here we needed to focus on their ability to regain their normal eating habits, the normal confidence, gain the muscle mass, regain the balance, the joint stabilities, all coming from systematic, planned physiotherapy, exercises, nutrition, and repeated counseling and evaluation. Nutrition played a big role because one needed to address pre-existing malnutrition to begin with, deal with the loss of the nutritional components during the period when they were unwell, and the responses of the body in terms of losing protein, etc. All that needed to be made up adequately without causing any significant imbalance. Evaluation of their moods, the sleep disorders became very important because there were significant deviations in these parameters, resulting in significant number existing, developing, or experiencing severe kind of panic attacks or mood disorders. There were significant cognitive and behavioral disorders which needed significant treatment. So again, the assessment depended on all the systems that were involved. So at every stage, what we suggested was, once one overcame the immediate illness, a focus on a regular follow-up with a dedicated physician with an understanding of the broad requirements in terms of reestablishment came into being. The psychological support, I think I would want to re-emphasize at the cost of repetition, became extremely important. And that had to continue and make sure that there was an adherence to the rehabilitation programs. Investigations, both blood investigations, chest x-rays and CT scans for periodic follow-up was essential to identify that small group of patients who might suffer more and who needed more intensive follow-up care. So I think broadly, that is my thoughts on how we needed to look at preventing the possible diseases, preventing the complications arising from contracting the disease, preventing the transmission of the disease, which would now bring me to the question of the value of the vaccines. There has been a lot of discussion, a lot of controversies about the timing of the vaccine, the dosages, the imported vaccines, the Indian vaccines, the side effects and possible outcomes due to the vaccines or the disease itself. The two important parameters to remember with every vaccine preventable disease the world over has been that, God forbid, if there has to be a disease, immunization will definitely make it milder. So the outcomes for people who have contracted the disease tends to be better. It was very evident when we did our own analysis of a large health force of the Apollo group of hospitals. When we looked at our medical workforce with so much exposure to COVID, and when we looked at the value of immunization, there is no doubt at all that while immunization could not have completely stopped you from getting the disease, it certainly made it milder with significantly superior outcomes. Similarly, going forward with the concerns about the rising numbers, the emerging newer strains and mutations, whatever I tell you today may not apply for tomorrow or the day after. We are continuing to learn. The disease pattern is continuing to change, and you and I may not be able to prepare adequately for it. But for the time being, if we were to still follow the basic of hand sanitization, social distancing, wearing the mask, maintaining the basics of health, exercise, and nutrition, I dare say most of us would continue to be active members doing well in reciprocity and beyond. So let me thank you for the opportunity, and I would be very happy to take on any specific